Okay, today we're going to talk about the importance of prepping a balloon properly for angioplasty. Angioplasty is the treatment of disease in different arteries and veins that can be caused from stenosis or calcium buildup. The importance of opening these vessels is to help improve blood flow, um, just open that artery back up, push open the vessel walls, the calcium, get it out of the way. So there's different types of balloons. There's a few low profile balloons, and there's also high pressure balloons. The high pressure balloons are made from Kevlar, which is what bulletproof vests and things like that are made of. So they're really strong, they're really tight to help open up those really tight vessels. So we'll begin a case and we'll prep the patient in the proper area depending on where the stricture that we're looking at is. They'll be draped in sterile fashion, and then the doctor will get access, and we will use different catheters and wires to get to the location of where we need to take the angiogram. The angiogram is going to show us exactly where the lesion is. It's going to help us size and pick out the correct balloon and the right way of treatment. So here's the initial angiogram, and you can see the lesion here. This is actually in the SFA, which is the main artery that is going down your thigh. Lots of different lesions up here that can cause limited blood flow to your foot. So it's really important to open this back up. So once the doctor takes the image and decides on what type of balloon he wants to use and the size, it will be opened by the circulator, and it'll be opened sterilely, and it will come out, and it usually comes in a hoop. And this is the wire port back here. It will be flushed. You'll just push forward until you see the saline coming back out. And then this does not come with the balloons. It will be opened separately, and it's a 3-way stopcock. And the balloon port is here on the side. We'll attach the 3-way, make sure that it is turned off to the balloon. And we'll take a 10mm syringe that's half filled with a mixture of 50% contrast and 50% heparinized saline. And of course there's going to be air in this syringe, so we're going to push the air out the side, and then we're going to turn and pull back any air that's in the balloon, and then you can hear the noise. That's just the air being released. So we're going to push that air back out, and we're going to do this about 3 or 4 times to make sure that it is good and prepped. So pushing the air back out, turning it off, pushing it back out. So once this is done, we can remove the syringe, and we'll actually attach an inflator device. Now, it is ready to be loaded onto the wire, and we will use fluoroscopy to make sure it has little markers here on the two ends, so we can see exactly where it is. So we'll push it to the lesion and try to get it right in the middle. And then, since I don't have an inflator, we will just use this to blow the balloon up. It will blow up. Okay. And then we can just release it. And on the image, since we have the contrast in there, we can actually see it opening up, and it will usually have like a dog bone like appearance, which will show us that we're actually hitting the lesion right smack dab in the middle. And sometimes we start off with like a little bit smaller balloons and then work our way up just to really help keep pushing. And you never want to oversize and risk tearing the artery or anything like that, causing any type of dissection. So after the vessel, you can see there's a lot more blood flow, and the black is just the contrast. So we went from this with the lesion, and then we opened it up here, and this did not require any stenting. They try to not stent as much as possible, but so it's really, really important to always make sure you prep the balloon properly. Depending on where you're at in the body, of course, if there's air in it, it's not going to expand the way we want it to, which is not going to give us any true benefit. So if you notice when you're blowing it up, to that there's air in it, you can always take it back out, re-prep, and then put it back in. So if you're working somewhere in the legs and it busts, it's probably not going to be that big of an issue, but sometimes we use ballooning up here around the neck, subclavian, carotid region, and if it does rupture, then it's going to send air to your brain and cause a stroke. So it is very, very important the proper prep for the balloon is done.